What we have here are our PAP pressure devices. PAP machines are referred to as CPAP machines, BiPAP machines, and VPAP machines. What PAP stands for is positive airway pressure. CPAP is a continuous positive airway pressure. It is one number, usually between 4 and 20. It is in centimeters of water pressure, and it is a fixed rate of air pressure that will allow the patient to get oxygen into the blood. BiPAP is bi-level positive airway pressure, also referred to as spontaneous positive airway pressure. This here is your CPAP machine. Your CPAP, continuous positive airway pressure machine, is electrical, so you do have an electrical power cord that is detachable from the machine itself and will need to be plugged into a grounded electrical outlet for proper and safe function. On the back side of your machine, you also have a filter cover, which we'll simply remove as such. And you would like to check the filter here periodically, at least once a month, to make sure that there is no dirt caught within the filter and there are no holes within the filter. The filter is not cleanable, so if you do need a new filter, you will need to contact Advocare Systems for a replacement. The filter will only need to be changed out once every 6 months. When your filter cover is in place and your filter is in place, you may go ahead and plug in your power cord and then plug your power cord into your power outlet. With your CPAP machine, once it is powered on, you will have a display. Your patient display will display a ramp time if activated for a patient. What a ramp time will do will allow the patient or the user an allotted amount of time to slowly increase to their full therapy setting as they gradually fall asleep. This may be set anywhere from 5 minutes up to 45 minutes. The features of your machine: on the front here you have the spout. The spout is where all your air pressure will exit from your CPAP machine. When it comes to accessories, the accessories used for your CPAP machine are your PAP corrugated tubing. In this case, this one is 6 feet, both female sides. One side of your CPAP tubing or PAP tubing will connect to the front of the machine, and the other side of your PAP tubing will connect to your accessories, such as your full mask, which will go over the patient's nose and mouth with a positioner cushion for patient comfort positioning, and a headgear to be able to strap the headgear and the mask securely to the face. Whenever using any type of CPAP or BiPAP treatment, you always want to have the best mask fit possible for the patient to receive the best therapy possible from their CPAP or BiPAP machine. Another type of mask that you may use, in this case this is a pediatric one, is a nasal mask. The nasal mask will simply just go over the patient's nose with a headgear to be able to secure the nasal mask to the patient snugly with the less leak as possible, and then your spout to connect to your PAP tubing. A third option may be your nasal pillows. Your nasal pillows will be sort of like nasal cannulas, where they would have pillowed inserts that can insert into the patient's nostrils while being secured to the patient's head with the headgear. And then of course you have your tubing to your tubing connection to connect to your PAP tubing. Either 3 of these masks may work by simply connecting it as such. This is your full mask connected to your CPAP tubing to your CPAP machine. This would be a nasal mask connected to your PAP tubing and CPAP machine. And then this would be your nasal pillows secured to your PAP, connected to your PAP tubing and CPAP machine. Either three of these masks would be appropriate to use for CPAP or BiPAP treatment. We said CPAP is continuous positive airway pressure, usually one number between 4 and 20, one setting. Now, what the positive airway pressure is used for is to create a positive airway pressure in the air sacs to keep them open and allow oxygen into the blood. Once your tubing is connected to your CPAP machine and the mask is fitted to the patient, you may go ahead and start or stop your therapy by pressing your start and stop button. These are fairly quiet, so a lot of times you may not hear the pressure. The patient may not hear it, but they definitely will feel it as they're using their CPAP pressure. Now CPAP, we said continuous positive airway pressure, one number will be the same amount of pressure to hold open the air sacs to allow oxygen into the blood, whether the patient is inspiring or inhalating or expiring or exhalation. Some CPAP machines may be equipped with a high leak alarm. If your machine does have a high leak alarm, you will want to make sure you readjust the mask to the patient's face for proper fitment and the best fit possible, as well as inspect your PAP corrugated tubing for any cracks or hardening. You may clean your PAP corrugated tubing and PAP mask on a daily basis with a mild soap and water solution. Simply disconnect your tubing from your mask and from the machine. Submerge it in a mild soap and water solution. Let it soak for approximately 20 minutes and then rinse it thoroughly. Make sure you do not keep the tubing in direct sunlight, as direct sunlight may tend to harden and dry rot the tubing. As well as if there's any water droplets in the tubing, you would want to bend it at its halfway point and let it hang as such, so that any water droplets may work themselves out to the ends of the tubing as it is hanging, being dried. And then of course with your full mask, you would do the same by simply unvelcroing the straps, disconnecting the headgear from the mask, and then you may go ahead and proceed and rinse this with a mild soap and water solution. Let it air dry completely. Place it in a Ziploc bag until you are ready to use it for the next patient use. These masks are single patient use only, so in between every patient you would want to have a new mask. Once your mask and everything has been cleaned and dried, then you may reconnect your face gear and face mask to your headgear by simply placing the Velcro straps back into position from once where they were removed. A CPAP machine or a BiPAP machine may also be used with a humidifier during the colder months where the air and the heat is a little bit drier. If a humidifier is prescribed by the respiratory therapist, then there would, depending on the model, you would have a humidifier as such that may attach to the front or to the face of your actual CPAP or BiPAP machine. This here is a humidifier with heated humidity tray. If you were to lift the top cover up, your tray is removable. You would fill the water through the top of your tray. You would only fill it to the maximum line. You want to check on your water on a daily basis. Change the water twice a day recommended, once a day for sure. You do not want any bacteria to build in the water. You will only want to use demineralized or distilled water, because any other water will have iron and calcium deposits that will cause a buildup and tend to clog your tray. Once the water has been filled, you may close the cap until it locks and secures in place. Then, from your CPAP machine, sometimes we'll have a blind cap that will cover the data port in which your humidifier would plug into. Once your cap has been uncovered, you may take your humidifier and simply attach it to the front of your CPAP machine. At that time, now you would have your CPAP machine with your heated humidity. Once your humidifier tray is attached to your CPAP machine, then your tubing would connect to the front of the humidifier attachment and then proceed to the mask, whether it's a full mask, nasal mask, or nasal pillows. Once again, CPAP is continuous positive airway pressure, one number, one setting. If you experience a loss of power from your CPAP machine or no display on your LCD, you will always want to check your power source and check your power outlet. If your tubing becomes hardened or cracked, it would need to be switched out. If your mask gets hardened or cracked, it would also need to be replaced. One other accessory that a patient may need to require when using their CPAP or BiPAP machine is your O2 side port connector. Your oxygen side port connector is a connector that will fit to the front of your CPAP machine. Once you remove your tubing, that will allow you to adapt your oxygen source into your CPAP or BiPAP treatment. So this would be your side port connector. This would be your PAP tubing. This would go to your mask. And then your oxygen source will bleed into your PAP therapy from your oxygen tubing through the side port connector stem here. The next machine we have here is your VPAP machine, or also BiPAP machine. You have CPAP, BiPAP, and VPAP. A CPAP is continuous positive airway pressure. A BiPAP is bi-level positive airway pressure, also known as spontaneous. And a VPAP is a variable positive airway pressure machine, which will allow the user to select either CPAP mode or BiPAP mode, depending on the therapy required for any patient. In this instance, the VPAP will be used as a BiPAP. Now, BiPAPs, also referred to as spontaneous positive airway pressure, usually have two settings. You have a larger number, such as 12, over a smaller number, such as 6. The large number would be the IPAP, also referred to as inspiratory, and the smaller number would be your EPAP, also referred to as expiratory. The reason you have two settings with your BiPAP machine is because BiPAP, meaning bi-level, also spontaneous. The reason it is spontaneous because it will act as respond to the patient's breath control and breaths per minute. So as the patient inspires, it will increase the air pressure in the tubing to allow the patient to get oxygen into the blood easier. And as the patient expires, it will decrease the pressure in the tubing, making it easier for the patient to exhale as the patient has his expiration. With your BiPAP or VPAP machine, once again, you have your power cord that connects to the back of your BiPAP machine. It is detachable at that point, so you always want to make sure it's firmly attached there and firmly attached to your ground electrical outlet for proper and safe function in cases where your machine does not have any power. Above your power cord, you may have your power switch that will activate your power for your BiPAP or VPAP machine. And then once again, you do have your filter. Filter cover is removable by simply pulling it off. Always check your filter once a month to make sure there's no debris on it. Make sure there's no holes. Blue side of the filter should always be face outward. Place that back in. Place your filter cover over. Either your CPAP or BiPAP machine should not be used if your filter and filter cover is not in place. Coming to the front of your BiPAP machine, you would have a similar spout where you would connect your PAP tubing or O2 side port connector if oxygen is required for your BiPAP therapy, and then proceeding on to the patient's accessories such as your full mask, nasal mask, or nasal pillows. So once again, you have your oxygen side port connector as such, and as you can see, all accessories for your CPAP and BiPAP machine are interchangeable and universal from CPAP to BiPAP. What does change, however, is the type of therapy that your CPAP and BiPAP machine will provide for any given patient. So once our side port connector is connected to the machine, if oxygen is being used, we would proceed and connect our PAP tubing, and then follow the rest of the connection from the PAP tubing to either the full mask, nasal mask, or nasal pillow. And of course, before any therapy is activated from your machine, you always want to make sure the headgear has the best fit possible to the patient's face. When you activate the power on your BiPAP machine, that's when your LCD display will display. Once your LCD has been displayed, then you will go ahead and see the patient menu. Whenever using your CPAP or BiPAP treatment, you would always want to take notice of your positions of your buttons. This large button here is the start and stop of your PAP treatment. To start your PAP treatment, you would press the button to activate the air pressure. To stop your PAP treatment, you would press it again to stop the air pressure. Anytime you press the button will activate or deactivate your air pressure. If you can see here, our unit has just went into a high leak adjust mask alarm. What this usually signifies is that the mask has a high leak and it is not properly adjusted or fitted to any patient properly. So to correct that high leak adjust mask error message, you want to stop the airflow, check the mask fitment for your patient, readjust and fit the mask as necessary for the patient, and once all adjustments are made, then you may go ahead and restart your therapy. When it comes to your BiPAP therapy, the reason that you have IPAP, which is a larger number, is because the patient would need more help to hold open the air sacs when the patient is breathing while they're sleeping. And then the smaller number would be the EPAP, because there would be less pressure needed in the air tubing for the patient to exhale and expire. Just like your CPAP, your BiPAP may also be used with humidity. To be able to use your BiPAP with humidity, first you would want to power off, remove the front cover, and then we will replace it with our humidity tray. The humidity tray is removable from the heat plate by removing it as such. To be able to unlatch it, you would unlatch the tube, and then you may lift open the top. Once it is open, you may go ahead and pour the water in through that open area there, making sure you never move past the maximum point. Once again, only use demineralized or distilled water. Change your water twice a day recommended, once a day for sure. Once your humidity tray has been filled with the distilled water, you may go ahead and close that. Relock your latches to make sure it stays closed, and then replace your humidity tray in your heated humidity tray front placement. Once your humidifier has been adapted to your CPAP or BiPAP machine, then you may go ahead and continue the rest of your connection as before. Side port connector if using oxygen, corrugated tubing to the patient's mask. Once the mask is fitted to any patient, your power has been started on your machine. You may go ahead at that time, start your therapy. Please take note, it is always good procedure to fit the mask to the patient and secure the mask to the patient's face prior to starting or stopping any airflow treatment. Doing this setup of securing and adjusting the mask to the patient prior to starting or stopping your treatment would help remedy any future errors that you may get from high leak alarms. If for any reason you would feel your CPAP or BiPAP therapy is not working for you as recommended by your therapist, you will need to contact your respiratory therapist in order to get a new prescription for your CPAP or BiPAP setting.